Hi everyone, this is Glenda Ganzon and welcome to my Human Anatomy and Physiology class. And for today's video, I'm going to introduce to you the pelvic girdle and the pelvis of the human skeletal system. So stay tuned. The pelvic girdle, or what we call as the hip girdle, is formed by a single bone, which is the hip bone or coxal bone, which serves as attachment point of each lower limb, and each hip bone in turn is firmly joined to the axial skeleton via its attachment to the sacrum of the vertebral column. The right and the left hip bones also converge anteriorly to attach to each other. The bony pelvis is the entire structure formed by the two hip bones and the sacrum, and attached inferiorly to the sacrum is the coccyx. Unlike the bones of the pectoral girdle, which are highly mobile to enhance the range of upper limb movements, the bones of the pelvis are strongly united to each other to form a largely immobile, weight-bearing structure. And this is important for stability because it enables the weight of the body to be easily transferred laterally from the vertebral column through the pelvic girdle and hip joints and into either lower limb whenever the other limb is not bearing weight. Thus, the immobility of the pelvis provides a strong foundation for the upper body as it rests on top of the mobile lower limbs. The hip bone or coxal bone forms the pelvic girdle portion of the pelvis. The paired hip bones are the large curved bones that form the lateral and anterior aspect of the pelvis, and each adult hip bone is formed by three separate bones that fuse together during the late teenage years. These bony components are the ilium, ischium, and pubis, and these names are retained and used to define the three regions of the adult hip bone. The ilium is the fan-like superior region that forms the largest part of the hip bone, and it is firmly united to the sacrum at the largely immobile sacroiliac joint. The ischium forms the posterior inferior region of each hip bone, and it supports the body when sitting. The pubis forms the anterior portion of the hip bone, and the pubis curves medially where it joins the pubis of the opposite hip bone at the specialized joint called the pubic symphysis. For the ilium, when you place your hands on your waist, you can feel an arcing superior margin of the ilium along your waistline, and this curved superior margin of the ilium is the iliac crest. So the rounded anterior termination of the iliac crest is the anterior superior iliac spine, and this important bony landmark can be felt at your anterolateral hip. Inferior to the anterior superior iliac spine is the rounded protuberance called the anterior inferior iliac spine. Both of these iliac spines serves as attachment points for muscles of the thigh, and posteriorly the iliac crest curves downward to terminate as the posterior superior iliac spines. Muscles and ligaments surround but do not cover this bony landmark, thus sometimes producing a depression seen as the dimple located on the lower back, and more inferiorly is the posterior inferior iliac spine. This is located at the inferior end of a large roughened area called the auricular surface of the ilium. So this auricular surface articulates with the auricular surface of the sacrum to form the sacroiliac joint, and both the posterior superior and the posterior inferior iliac spine serve as attachment points for the muscles and very strong ligaments that support the sacroiliac joint. So the shallow depression located on the anteromedial or internal surface of the upper ilium is called the iliac fossa. The inferior margin of this space is formed by the accurate line of the ilium, the ridge formed by the pronounced change in the curvature between the upper and lower portion of the ilium, and the large inverted U-shaped indentation located on the posterior margin of the lower ilium is called the greater ischiatic notch. The ischium forms the posterior lateral portion of the hip bone, and the large roughened area of the inferior ischium is the ischial tuberosity. This serves as the attachment for the posterior thigh muscles and also carries the weight of the body when sitting. And you can feel the ischial tuberosity if you wiggle your pelvis against the seat of the chair, projecting superiorly and anteriorly from the ischial tuberosity is a narrow segment of bone called the ischial ramus. So the slightly curved posterior margin of the ischium above the ischial tuberosity is the lesser sciatic notch. The bony projection separating the lesser sciatic notch and greater sciatic notch is the ischial spine. For the pubis forms the anterior portion of the hip bone, which is the enlarged medial portion of the pubis is the pubic body. Located superiorly on the pubic body is a small bump called the pubic tubercle. The superior pubic ramus is the segment of bone that passes laterally from the pubic body to join the ilium. The narrow ridge running along the superior margin of the superior pubic ramus is the pectineal line of the pubis. The pubic body is joined to the pubic body of the opposite hip bone by the pubic symphysis. Extending downward and laterally from the body is the inferior pubic ramus. The pubic arch is the bony structure formed by the pubic symphysis and the bodies and inferior pubic rami of the adjacent pubic bones. The inferior pubic ramus extends downward to join the ischial ramus, and together this forms the single ischiopubic ramus, which extends from the pubic body to the ischial tuberosity. So the inverted V shape formed as the ischiopubic rami from both sides come together at the pubic symphysis, and it is called the subpubic angle. On the other hand, the pelvis consists of four bones, the right and left hip bones, the sacrum, and the coccyx. The pelvis has several important functions. Its primary role is to support the weight of the upper body when sitting and to transfer this weight to the lower limbs when standing. So it serves as an attachment point for trunk and lower limb muscles and also protect the internal pelvic organs. So when standing in the anatomical position, the pelvis is tilted anteriorly. In this position, the anterior superior iliac spines and the pubic tubercles lie in the same vertical plane, and the anterior or internal surface of the sacrum faces forward and downward. So the three areas of each hip bone, the ilium, pubis, and ischium converge centrally to form a deep cup-shaped cavity called the acetabulum. So this is located on the lateral side of the hip bone and is part of the hip joint. The large opening in the anterior inferior hip bone between the ischium and pubis is the obturator foramen, and this space is largely filled in by a layer of connective tissue and serves for the attachment of muscles on both its internal and external surfaces. Several ligaments unite the bones of the pelvis. The largely immobile sacroiliac joint is supported by a pair of strong ligaments that are attached between the sacrum and ilium portion of the hip bone, and these are the anterior sacroiliac ligament on the anterior side of the joint and the posterior sacroiliac ligament on the posterior side. Also spanning the sacrum and hip bone are the two additional ligaments. The sacrospinous ligament runs from the sacrum to the ischial spine, and the sacrotuberous ligament runs from the sacrum to the ischial tuberosity, and these ligaments help to support and immobilize the sacrum as it carries the weight of the body. The sacrospinous and the sacrotuberous ligaments also help to define two openings on the posterolateral sides of the pelvis through which muscles, nerves, and blood vessels for the lower limb exit. So the superior opening is the greater sciatic foramen. This large opening is formed by the greater sciatic notch of the hip bone, the sacrum, and the sacrospinous ligament. The smaller, more inferior, lesser sciatic foramen is formed by the lesser sciatic notch of the hip bone together with the sacrospinous and the sacrotuberous ligaments. This space enclosed by the bony pelvis is divided into two regions. The broad superior region, defined laterally by the large fan-like portion of the upper hip bone, which is called the greater pelvis or greater pelvic cavity or false pelvis. And this broad area is occupied by portions of small and large intestine, and because it is more closely associated with the abdominal cavity, it is sometimes referred to as the false pelvis. More inferiorly, the narrow rounded space of the lesser pelvis, which is lesser pelvic cavity or what we call as the true pelvis. And it contains the bladder and other pelvic organs, and thus it is also known as the true pelvis. So the pelvic brim, which is known as the pelvic inlet, forms the superior margin of the lesser pelvis, separating it from the greater pelvis. The pelvic brim is defined by a line formed by the upper margin of the pubic symphysis anteriorly and the pactineal line of the pubis, the arcuate line of the ilium, and the sacral promontory, which is the anterior margin of the superior sacrum posteriorly. So the inferior limit of the lesser pelvic cavity is called the pelvic outlet. This large opening is defined by the inferior margin of the pubic symphysis anteriorly and the ischial-pubic ramus, the ischial tuberosity, the sacrotuberous ligament, and the inferior tip of the coccyx posteriorly. Because of the anterior tilt of the pelvis, the lesser pelvis is also angled, giving it an anterior superior or pelvic inlet to the postero-inferior or the pelvic outlet orientation. If we try to compare the female and male pelvis, the differences between the adult female and male pelvis relate to function and body size. So in general, the bones of the male pelvis are thicker and heavier, adapted for support of the male's heavier physical build and stronger muscles. So the greater sciatic notch of the male hip bone is narrower and deeper than the broader notch of females. Because the female pelvis is adapted for childbirth, it is wider than the male pelvis, as evidenced by the distance between the anterior superior iliac spines. And the ischial tuberosities of the females are also farther apart, which increases the size of the pelvic outlet. Because of this increased pelvic width, the subpubic angle is larger in females than it is in males. The female sacrum is wider, shorter, and less curved, and the sacral promontory projects less into the pelvic cavity, thus giving the female pelvic inlet or the pelvic brim a more rounded or oval shape compared to males. And the lesser pelvic cavity of the females is also wider and more shallow than the narrower, deeper, and tapering lesser pelvis of males. Because of the obvious differences between female and the male hip bones, this is one bone of the body that allows for most accurate sex determination. So this ends my discussion about the pelvic girdle and the pelvis, And if you have any question, please write it in the comment section down below and I'll be glad to answer them all. And if you haven't subscribed yet to my channel, please do consider subscribing. Also, hit the notification bell so that you'll be updated with my new videos. And if you like this video, please give it a thumbs up and share. So once again, I would like to thank you all for watching this video and for listening to my discussion. Until my next video, bye everyone!